Question 1. What is the primary role of the Canadian Association of Medical Radiation Technologists, CAMRT?
A.
To hire and fire technologists in Canadian hospitals. B. To act as the national professional association and certifying body for MRTs. C. To set the salaries for all medical imaging staff. D. To directly treat patients with radiation. Answer. B. To act as the national professional association and certifying body for MRTs. This question tests your understanding of the CAMRT's main purpose. The keyword primary role asks for the most important function of the organization. The CAMRT serves as the single national voice for medical radiation technologists, MRTs, providing certification and advocating for the profession. It does not handle hospital staffing, set wages, or perform clinical treatments on patients. For example, after graduating from an accredited program, a technologist writes the CAMRT exam to become certified to practice in Canada. Remember this simple tip. CAMRT stands for Certification, Advocacy, and a National Voice for MRTs. Question 2. Which of the following is one of the four main disciplines represented by the CAMRT?
A.
Phlebotomy. B. Sonography. C. Nuclear medicine technology. D. Physiotherapy. Answer. C. Nuclear medicine technology. This question asks you to identify a core discipline under the CAMRT umbrella. The keywords for main disciplines signal that you need to know the specific groups CAMRT represents. Nuclear medicine technology is one of the four key areas, along with radiological technology, radiation therapy, and magnetic resonance imaging. Sonography and physiotherapy are separate healthcare professions with their own associations. For instance, a nuclear medicine technologist uses radioactive substances to see how organs in the body are working. A good way to remember the disciplines is that they all use a form of radiation or advanced imaging technology to diagnose or treat patients. Question 3. What is the purpose of the CAMRT certification exam?
A.
To determine a technologist's annual salary. B. To ensure a technologist meets the national standard for entry-level practice. C. To grant a technologist a license to practice in a specific province. D. To rank technologists from best to worst in the country. Answer. B. To ensure a technologist meets the national standard for entry-level practice. This question focuses on the reason for the CAMRT exam. The key phrase purpose of the exam asks what the test is designed to achieve. The exam's goal is to confirm that a new graduate has the essential knowledge and skills to work safely and effectively as a medical radiation technologist. It is not used for salary calculations or ranking, and while it's required for licensing, the license itself is granted by provincial bodies. For example, successfully passing the exam means a new MRT has demonstrated the competence needed to perform their job correctly from day one. Think of the CAMRT exam as the national quality check for all new MRTs. Question 4. The CAMRT's Code of Ethics primarily serves to
A.
List the technical skills required for operating imaging equipment. B. Provide guidelines for professional and ethical conduct. C. Outline the steps for renewing annual membership. D. Detail the history of medical radiation technology in Canada. Answer. B. Provide guidelines for professional and ethical conduct. This question tests your knowledge of the Code of Ethics. The keywords Code of Ethics refer to the set of rules about professional behavior. Its main purpose is to guide technologists in making morally sound decisions that prioritize patient well-being, confidentiality, and professional integrity. The code is about how to act professionally, not about how to use equipment or pay membership fees. For example, the code would guide a technologist on how to respectfully handle a situation where a patient is anxious or refusing a procedure. Remember, the Code of Ethics is all about doing the right thing for the patient and the profession. Question 5. What does the acronym CPD stand for in the context of the CAMRT?
A.
Canadian Patient Database. B. Core Professional Duties. C. Continuing professional development.
D.
Certified practitioner diploma. Answer: C. Continuing professional development. This question asks for the meaning of a common acronym used by CAMRT. In the context of the CAMRT is a clue that it relates to a technologist's career. CPD refers to the ongoing learning activities that MRTs must complete to maintain their skills and knowledge throughout their careers. It's about staying current with new technologies and best practices, not about patient databases or diplomas. For instance, attending a workshop on a new MRI technique or reading a research article counts as a CPD activity. An easy way to recall this is to think of CPD as the commitment to continue professional development forever. Question 6. Which body is responsible for issuing a license to practice as an MRT in a specific province?
A.
The CAMRT National Office. B. The Canadian Medical Association. C. The Federal Government of Canada. D. The Provincial Regulatory Body. Answer: D. The Provincial Regulatory Body. This question checks your understanding of the difference between national certification and provincial licensing. The key phrase "license to practice" is what separates this from the CAMRT's role. While CAMRT provides the national certification, the legal permission or license to work in a particular province is granted by that province's own regulatory organization. These bodies exist to protect the public within their specific jurisdiction. For example, in Alberta, an MRT needs a practice permit from the Alberta College of Medical Diagnostic and Therapeutic Technologists, ACMDTT. Always remember, CAMRT certifies you for the country, but the province licenses you to work there. Question 7. The CAMRT's Best Practice Guidelines, BPGs, are developed to
A.
Mandate specific work hours for technologists. B. Provide evidence-based recommendations to improve patient care. C. List the top-rated imaging equipment for purchase. D. Set the fees for medical imaging procedures. Answer: B. To provide evidence-based recommendations to improve patient care. This question is about the purpose of best practice guidelines. The term best practice implies a standard of high-quality care. BPGs are documents created by CAMRT to help technologists use the most current and effective methods in their daily work to ensure safety and quality. They are recommendations based on research, not strict rules about work hours or equipment brands. For example, a BPG might provide detailed guidance on the safest way to perform a CT scan on a child to minimize radiation dose. Think of BPGs as the official how-to guides for providing the best possible care. Question 8. In which Canadian city is the national head office of the Canadian Association of Medical Radiation Technologists, CAMRT, located?
A.
Toronto, Ontario. B. Vancouver, British Columbia. C. Ottawa, Ontario. D. Montreal, Quebec. Answer: C. Ottawa, Ontario. This question tests basic factual knowledge about the CAMRT's organizational structure, and the keyword head office refers to its main administrative base. The CAMRT's national office, which serves as the central hub for its operations across Canada, is located in Ottawa, Ontario. Its location in the nation's capital is strategic, allowing the association to effectively interact with federal government bodies and national health organizations. For example, being in Ottawa makes it easier for the CAMRT to advocate on policy matters that affect the medical radiation technology profession at a federal level. Remember, many national associations are based in the capital city to be close to the center of national governance. Question 9. Maintaining patient confidentiality is a key principle in which CAMRT document?
A.
The annual financial report. B. The membership renewal form. C. The Code of Ethics. D. The list of accredited schools. Answer: C. The Code of Ethics. This question connects a specific professional duty to the correct guiding document. The keyword confidentiality refers to the duty to protect a patient's private information. This core professional responsibility is a major component of the CAMRT Code of Ethics, which outlines the moral obligations of all MRTs. Financial reports or school lists would not contain this type of professional guidance. For example, this principle means a technologist cannot discuss a patient's diagnosis or personal details with friends or family. Remember that the Code of Ethics is the rulebook for professional and responsible behavior, with patient privacy at its heart. Question 10. What does the credential, RTR, signify after a technologist's name?
A.
Registered in Therapeutic Radiology. B. Registered Technologist in Radiological Technology. C. Retired Technologist in Radiology. D. Research Technologist in Radiology. Answer. B. Registered Technologist in Radiological Technology. This question asks you to define a professional credential awarded through CAMRT. The acronym RTR is a specific designation that indicates a professional's qualifications. It means the individual has successfully passed the CAMRT certification exam in the discipline of radiological technology and is registered with the association. This credential is a mark of meeting the national standard of competence for X-ray, CT, and mammography. For instance, a hospital job posting might list CAMRT certification, RTR, as a mandatory requirement. Think of these letters as proof that the technologist is nationally certified in their specific field. Question 11. The CAMRT's mission is focused on advancing the profession and supporting its members to promote
A.
the sale of medical imaging equipment. B. Higher salaries for physicians. C. Quality patient care and healthcare. D. The construction of new hospitals. Answer. C. Quality patient care and healthcare. This question is about the ultimate goal of the CAMRT's activities. The word mission refers to the organization's core purpose. Everything the CAMRT does, from certification to providing resources, is aimed at ensuring MRTs provide the highest standard of care, which contributes to the overall quality of Canada's healthcare system. The association's focus is on professional standards and patient well-being, not on commercial sales or hospital construction. For example, by offering courses on new imaging techniques, CAMRT helps members improve their skills, leading directly to better patient outcomes. Just remember, the patient is at the center of the CAMRT's mission. Question 12. Which of the following is a direct benefit of being a CAMRT member?
A.
A guaranteed job upon graduation. B. Exemption from all provincial laws. C. Access to professional liability insurance.
D.
A free car for commuting to work. Answer. C. Access to professional liability insurance. This question tests your knowledge of the practical advantages of CAMRT membership. A direct benefit is something the association provides to its members. Professional liability insurance, which protects technologists from potential legal issues related to their practice, is a key benefit included with CAMRT membership. The association cannot guarantee jobs or provide exemptions from laws, and a free car is not a realistic professional benefit. For instance, this insurance gives a technologist peace of mind that they are protected while performing their duties. Think of membership benefits as the tools and protections CAMRT provides to support you in your career. Question 13. How does CAMRT support the education of future MRTs?
A.
By directly owning and operating all training schools. B. By setting the tuition fees for students. C. By co-managing the accreditation of educational programs. D. By providing free housing to all students. Answer. C. By co-managing the accreditation of educational programs. This question asks about CAMRT's role in education. The keyword support indicates how the association contributes to the training of new professionals. CAMRT works with another body, Equal Canada, to accredit, which means to officially approve, MRT educational programs across the country, ensuring they all meet high national standards. It does not own the schools or set tuition fees. For example, this accreditation process ensures that a student in British Columbia receives an education of the same quality as a student in Newfoundland. Remember, CAMRT's role in education is about quality control, not day-to-day management of schools. Question 14. What is the name of the official scholarly journal published by the CAMRT?
A.
Journal of Medical Imaging and Radiation Sciences, CAMRT. B. Canadian Healthcare Today. C. The Modern Technologist. D. Radiology Monthly Digest. Answer. A. Journal of Medical Imaging and Radiation Sciences, CAMRT. This question tests your knowledge of a specific CAMRT publication. The term scholarly journal refers to a publication containing academic research and articles for professionals. The Journal of Medical Imaging and Radiation Sciences, CAMRT, is the official peer-reviewed journal of the CAMRT, providing members with the latest research in the field. The other options are plausible-sounding but incorrect names for this specific publication. For instance, an MRT might read an article in CAMRT to learn about a new technique for reducing patient radiation dose. Think of CAMRT as the CAMRT's own science magazine for the profession. Question 15. The concept of scope of practice for an MRT refers to
A.
The number of patients a technologist can see per day. B. The specific procedures and tasks a technologist is educated and authorized to perform. C. The geographical area in which a technologist is allowed to work. D. The type of imaging equipment a hospital is allowed to buy. Answer. B. The specific procedures and tasks a technologist is educated and authorized to perform. This question is about defining a key professional term. The phrase scope of practice outlines the professional boundaries of a job. For an MRT, this means the range of duties they are legally and professionally allowed to do based on their education, certification, and provincial regulations. It's about what you can do, not how many patients you see or where you work. For example, performing an X-ray is within a radiological technologist's scope of practice, but prescribing medication is not. A simple way to remember is, your scope of practice is your professional job description. Question 16. The principle of providing high-quality patient care is central to the CAMRT's values. What does this principle most clearly involve?
A.
Ensuring the hospital is profitable. B. Combining competence, safety, and compassion in every interaction. C. Completing procedures as quickly as possible, regardless of outcome. D. Using only the most expensive equipment available. Answer. B. Combining competence, safety, and compassion in every interaction. This question asks you to interpret a core CAMRT value. The phrase high-quality patient care is about the standard of service an MRT should provide. It means using your skills correctly, competence, protecting the patient from harm, safety, and treating them with kindness and respect, compassion. Quality care is not measured by speed, cost of equipment, or hospital profits. For instance, taking an extra minute to explain a procedure to an anxious patient is a perfect example of combining competence with compassion. Think of high-quality care as treating every patient as if they were your own family member. Question 17. After passing the National Certification Exam, an MRT is required to participate in which ongoing program to maintain their credentials?
A.
The Annual Staff Lottery. B. The Continuing Professional Development (CPD) program. C. The Hospital Expansion Committee. D. The Monthly Social Club. Answer. B. The Continuing Professional Development (CPD) program. This question tests your knowledge of post-certification requirements. The key phrase, maintain their credentials, points to the activities required to keep your certification active. The CAMRT requires all certified members to engage in continuing professional development, CPD, to ensure their knowledge remains up to date throughout their careers. This is a formal requirement, unlike social clubs or lotteries. For example, completing a set number of hours of learning activities each year is mandatory to renew your CAMRT registration. Remember, certification isn't a one-time event. It's a career-long commitment to learning. Question 18. An MRT who acts with integrity and honesty in all professional matters is upholding the principles found in the CAMRTs.
A.
Fee schedule. B. Website privacy policy. C. Code of ethics. D. Conference agenda. Answer: C. Code of ethics. This question connects professional virtues to the correct CAMRT document. The keywords integrity and honesty are fundamental ethical principles. These values are formally outlined in the CAMRT Code of Ethics, which serves as the moral compass for the profession. These principles guide how MRTs should behave in their roles, ensuring they are trustworthy and reliable. For instance, being honest about a mistake made during a procedure is a difficult but essential part of acting with integrity. Think of the Code of Ethics as the document that defines what it means to be a true professional. Question 19. The CAMRT advocates on behalf of its members to which group?
A.
International space agencies. B. The general public and governments. C. Fast food corporations.
D.
Professional sports leagues. Answer: B. The general public and governments. This question is about the advocacy role of the CAMRT. The word advocates means to publicly support or speak in favor of a cause. CAMRT represents the interests of MRTs to governments on policy matters and promotes the profession's value to the public to raise awareness. Their advocacy is focused on the healthcare sector, not unrelated industries like sports or food. For example, CAMRT might lobby the government for better funding for diagnostic imaging to reduce patient wait times. Remember, CAMRT is the public voice that speaks up for all MRTs in Canada. Question 20. What credential would a technologist certified in radiation therapy by the CAMRT use?
A. RTT.
B. RTR. C. RTNM. D. RTMR. Answer: A. RTT. This question tests your knowledge of the specific credentials for each discipline. The key phrase radiation therapy points to a particular specialty. The credential for a technologist certified in this field is RTT, which stands for Registered Technologist in Radiation Therapy. Each of the 4 disciplines has its own unique credential to identify a technologist's specific area of expertise. For example, an individual with the RTT credential is qualified to administer radiation treatments to cancer patients as prescribed by a radiation oncologist. An easy tip is to match the last letter of the credential with the discipline. T for therapy. Question 21. Which statement best describes the relationship between the CAMRT and provincial regulatory bodies?
A.
They are in competition with each other. B. They work in partnership, with CAMRT handling certification and provinces handling licensing. C. The CAMRT has the authority to overrule any provincial decision. D. They have no relationship and never communicate. Answer: B. They work in partnership, with CAMRT handling certification and provinces handling licensing. This question asks you to define the roles of 2 different types of organizations. The keywords relationship between require you to understand how they interact. CAMRT and provincial regulators have distinct but complementary roles. CAMRT provides the national standard certification, which is then used by the provinces to grant the legal permission to work, licensing. They are partners, not competitors, in ensuring public safety. For instance, to get a license to work in Ontario, you must first show proof that you have passed the CAMRT exam. Think of it like a driver's test. CAMRT gives you the pass certificate and the province gives you the actual driver's license. Question 22. The CAMRT defines entry to practice competencies to
A.
ensure all new graduates across Canada start with the same foundational skills. B. Limit the number of students who can enroll in MRT programs. C. Decide which hospitals receive new imaging equipment. D. Help technologists choose a specialty area.
Answer: A.
Ensure all new graduates across Canada start with the same foundational skills. This question is about the purpose of setting national standards for new graduates. The phrase entry to practice competencies refers to the basic skills a new MRT must have. CAMRT establishes these competencies to create a single, consistent standard of quality for all educational programs and their graduates nationwide. This ensures that no matter where an MRT is trained, they possess the essential abilities to practice safely. For example, one competency might be the ability to correctly position a patient for a chest X-ray. Remember, these competencies are the building blocks that every new MRT must have. Question 23. A student in an accredited medical radiation technology program can become what type of CAMRT member?
A.
Full member. B. Retired member. C. Corporate member. D. Student member. Answer: D. Student member. This question asks about membership categories within the CAMRT. The keyword student points directly to the specific membership type designed for them. The CAMRT offers a student membership category to individuals who are currently enrolled in an accredited MRT program, allowing them to access resources and connect with the profession before they graduate. Full membership is for certified technologists, while other categories serve different purposes. For instance, a student member might receive the CAMRT journal or get a discount on conference fees. Think of student membership as the first step on the professional ladder with CAMRT. Question 24. Upholding the principle of patient dignity in the CAMRT Code of Ethics means an MRT must:
A.
treat every patient with respect, regardless of their background or condition. B. only perform procedures on patients who are wealthy. C. share patient stories on social media. D. refuse to provide care to difficult patients. Answer: A. treat every patient with respect, regardless of their background or condition. This question tests your understanding of a specific ethical principle. The key phrase patient dignity refers to the inherent value and worth of each individual. Upholding this principle means treating every patient with courtesy, respect, and compassion, ensuring their privacy and comfort are maintained at all times. It is the opposite of discriminating against or disrespecting a patient. For example, providing a blanket for warmth and ensuring a privacy curtain is closed are simple yet powerful ways to respect a patient's dignity. A good takeaway is to always treat your patients the way you would want your loved ones to be treated. Question 25. The term Medical Radiation Technologist, MRT, is a broad title that includes professionals in
A.
only X-ray departments. B. all 4 disciplines: radiological technology, radiation therapy, nuclear medicine, and MRI. C. hospital administration only. D. the manufacturing of imaging equipment. Answer: B. all 4 disciplines: radiological technology, radiation therapy, nuclear medicine, and MRI. This question asks you to define the umbrella term, MRT. The title, Medical Radiation Technologist, is a comprehensive term used by the CAMRT to represent all professionals in its 4 distinct specialty areas. It is not limited to just one discipline like X-ray, nor does it refer to administrative or manufacturing jobs. For instance, when the CAMRT advocates to the government, it speaks on behalf of all MRTs, whether they work in radiation therapy or nuclear medicine. Remember, MRT is the family name for professionals in all 4 of CAMRT's core disciplines. Question 26. One of the main goals of the CAMRT's Continuing Professional Development (CPD) program is to
A.
ensure technologists' skills remain current and relevant. B. help technologists find a new job in a different field. C. provide a way to discipline members for mistakes. D. organize social events and parties for members. Answer: A. ensure technologists' skills remain current and relevant. This question focuses on the ultimate purpose of required ongoing learning. The goal of continuing professional development is to make sure that MRTs keep up with advancements in technology, safety protocols, and patient care techniques. Healthcare is always changing, and CPD ensures that a technologist's knowledge doesn't become outdated, which directly protects the public. For example, Taking a course on a new 3D imaging software helps an MRT provide better diagnostic information to doctors. Think of CPD as a career-long tune-up for your professional skills. Question 27. What does the CMRT credential RTNM stand for?
A.
Registered Technologist in Neuromammography. B. Registered Technologist in Nuclear Medicine. C. Real-Time Nuclear Monitor. D. Radiology Technician Non-Medical. Answer: B. Registered Technologist in Nuclear Medicine. This question tests your ability to identify the credential for a specific CMRT discipline. The acronym RTNM is the official designation for a technologist certified in nuclear medicine. This credential confirms that the individual has passed the national exam and meets the standards to practice in that specialty. Each of the 4 disciplines has its own unique credential, and this one is specific to those who use radiopharmaceuticals for diagnosis and treatment. For example, a professional with RTNM after their name is qualified to perform a PET scan. A helpful tip is to associate the NM in the credential with nuclear medicine. Question 28. If an MRT has a question about the most appropriate way to perform a specific imaging procedure, a reliable resource to consult would be the
A.
CMRT Best Practice Guidelines, BPGs. B. Hospital's Marketing Brochure. C. Local newspaper's health section. D. A patient's personal blog. Answer:
A.
CMRT Best Practice Guidelines, BPGs. This question asks you to identify the best professional resource for clinical guidance. The key phrase "most appropriate way" signals the need for an official, evidence-based document. The CAMRT's best practice guidelines are specifically created to provide MRTs with authoritative and up-to-date information on how to perform their duties safely and effectively. The other options are not reliable or professional sources for clinical practice. For instance, if an MRT is unsure about shielding a pediatric patient, the BPG on pediatric imaging would provide the correct protocol. Remember, for professional questions, always turn to professional resources like the BPGs. Question 29. The CMRT plays a role in public safety by
A.
Arresting individuals who misuse medical equipment. B. Ensuring that only qualified and competent individuals become certified MRTs. C. Inspecting every hospital in Canada for fire hazards. D. Setting the prices for prescription medications. Answer: B. Ensuring that only qualified and competent individuals become certified MRTs. This question is about how the CMRT contributes to protecting the public. The term public safety refers to the health and well-being of the community. CAMRT's primary contribution to this is its rigorous certification process, which acts as a gatekeeper to ensure that only those who have proven their competence are allowed to practice. The association does not have law enforcement or facility inspection powers. For example, the national exam tests a candidate's knowledge of radiation safety, which directly protects patients from unnecessary harm. Think of CMRT certification as a national seal of safety and competence. Question 30. The principle of professional responsibility means an MRT is accountable for
A.
The financial success of the hospital. B. Their own actions and the quality of their work. C. The personal life choices of their colleagues. D. The hospital's cafeteria menu. Answer: B. Their own actions and the quality of their work. This question asks you to define a core professional concept. The term professional responsibility means that an individual is answerable for their own professional conduct and the work they produce. It is about taking ownership of your duties and ensuring you meet the standards of the profession. An MRT is not accountable for the hospital's finances or their colleagues' private lives. For example, if an MRT produces a poor quality image, it is their responsibility to recognize it and repeat the procedure correctly. A good takeaway is, professional responsibility means you own your work, good or bad. Question 31. What is the name of the main national event held annually by the CMRT, which brings members together for educational sessions and networking?
A.
The Canadian Radiation Sciences Symposium. B. The CAMRT Annual General Conference. C. The National Medical Imaging Expo. D. The MRT Professional Development Summit. Answer: B. The CAMRT Annual General Conference. This question tests your knowledge of the CAMRT's main yearly event, and the keywords main national event and annually indicate a primary, recurring gathering. The CAMRT Annual General Conference is the association's signature event, designed to provide a national platform for learning and professional connection. It is the key opportunity for members across all disciplines to gather, share research, and learn about the latest advancements in the field. For example, a technologist might attend the conference to complete several of their required continuing education credits in one place. A great way to remember this is that as the main national association for MRTs, its biggest yearly meeting is simply called its Annual General Conference. Question 32. What does the CAMRT credential, RTMR, indicate?
A.
Registered Technologist in Mammography and Radiology. B. Registered Technologist in Medical Research. C. Registered Technologist in Magnetic Resonance. D. Real-Time Medical Responder. Answer: C. Registered Technologist in Magnetic Resonance. This question tests your knowledge of the specific credential for the MRI discipline. The acronym RTMR is the designation for a technologist who is nationally certified in magnetic resonance imaging. This credential shows that they have met the national standards of practice for this highly specialized field. The other options describe different roles or combine disciplines incorrectly. For example, a technologist with the RTMR credential is the expert who operates the MRI scanner to produce detailed images of soft tissues like the brain and joints. Remember, the MR in the credential is the key to linking it to magnetic resonance. Question 33. The CAMRT Standard of Practice documents describe the
A.
minimum level of expected performance for a competent MRT. B. Ideal, perfect performance that is impossible to achieve. C. Uniform and dress code for all MRTs in Canada. D. Annual vacation and sick day entitlements.
Answer: A.
The minimum level of expected performance for a competent MRT. This question asks you to define what a standard of practice is. This term refers to an official statement that describes the level of care and professionalism that a reasonable, prudent MRT would provide in a given situation. It outlines the baseline expectations for professional and clinical performance, not an unattainable ideal or administrative policies like dress codes. For example, a standard of practice would state that an MRT must verify the patient's identity and the requested procedure before beginning an examination. Think of the standards of practice as the fundamental rules of professional conduct you must meet every day. Question 34. A primary reason for an MRT to join their National Professional Association CAMRT is to
A.
avoid paying provincial income taxes. B. Show a commitment to their profession and access career resources. C. Receive a higher salary than non-members. D. Get discounts at local restaurants and movie theaters. Answer: B. Show a commitment to their profession and access career resources. This question explores the motivation for becoming part of a professional body. The primary reason is about the core value of membership. Joining the CAMRT demonstrates a technologist's dedication to professional standards and provides them with essential tools for their career, such as continuing education, guidelines, and networking opportunities. Membership does not affect taxes or guarantee a higher salary, and while some perks may exist, they are not the main purpose. For example, a member can access a webinar on a new imaging technique to improve their skills. Remember, joining CAMRT is about investing in your professional identity and growth. Question 35. One of the key responsibilities outlined in the CAMRT Code of Ethics is responsibility to the public. This includes
A.
participating in community service and health promotion. B. Advertising medical services to increase hospital revenue. C. Providing medical advice outside one's scope of practice. D. Sharing patient information with news reporters.
Answer. A.
Participating in community service and health promotion. This question asks you to interpret a specific section of the Code of Ethics. Responsibility to the public means using one's professional knowledge to benefit society beyond the walls of the clinic. This includes advocating for public health, promoting awareness about medical radiation, and acting as a trustworthy healthcare resource for the community. It explicitly forbids actions like breaking confidentiality or acting outside one's professional boundaries. For instance, an MRT might volunteer at a health fair to explain the importance of screening mammography. This principle means being a positive ambassador for healthcare in your community. Question 36. To become certified by CAMRT, a candidate must graduate from
A.
any university science program, B. an accredited medical radiation technology program, C. a high school physical education class, D. an online-only certificate course. Answer. B. an accredited medical radiation technology program. This question covers the educational prerequisite for certification. The keyword accredited is crucial, as it signifies that the educational program has been officially reviewed and approved for meeting national standards. CAMRT requires candidates to have completed their training at one of these recognized institutions to be eligible to write the certification exam. A general science degree or a non-accredited course is not sufficient. For example, schools like the Michener Institute or SAIT have accredited programs that prepare students for the CAMRT exam. Always remember, accreditation is the quality stamp required for your education. Question 37. The CAMRT's governance is overseen by
A.
single chief executive officer with absolute power, B. group of randomly selected hospital patients, C. board of directors elected by the members, D. committee appointed by the Prime Minister of Canada. Answer. C. a board of directors elected by the members. This question is about the leadership structure of the CAMRT. The term governance refers to how the organization is run. The CAMRT is a member-driven association, which means its direction is set by a board of directors whose members are elected by the voting members from across the country. This ensures that the leadership is representative of and accountable to the profession it serves. For instance, an MRT from Nova Scotia could be elected to the board to represent the interests of members in that region. Think of the board of directors as the elected government of the MRT profession in Canada. Question 38. The ethical principle of collaboration for an MRT involves
A.
working in isolation without communicating with others, B. competing with colleagues to see who can finish procedures fastest, C. working respectfully and effectively with other healthcare professionals, D. performing the duties of other professions, like nurses or doctors. Answer. C. working respectfully and effectively with other healthcare professionals. This question tests your understanding of a key professional behavior. The term collaboration means working together as a team. In healthcare, this involves MRTs communicating and cooperating with radiologists, nurses, physicians, and other team members to ensure the best and safest outcome for the patient. It is about teamwork, not competition or overstepping your professional boundaries. For example, an MRT might collaborate with a nurse to safely transfer an immobile patient onto the X-ray table. Remember, modern healthcare is a team sport, and collaboration is essential to winning for the patient. Question 39. Which of the following is an example of a continuing professional development (CPD) activity?
A.
Taking a 2-week vacation, B. attending a professional conference or webinar, C. reading a fictional novel, D. renewing your driver's license. Answer. B. attending a professional conference or webinar. This question asks you to identify a valid learning activity for an MRT. A CPD activity must be relevant to your professional practice and contribute to your knowledge or skills. Attending a conference or an educational webinar on a topic in medical imaging is a perfect example of formal learning that qualifies for CPD credits. Personal activities like vacations or reading fiction do not count as professional development. For example, listening to a lecture on new MRI safety protocols at a conference helps you stay current and meet CPD requirements. Think of CPD as any activity that makes you a better, more knowledgeable technologist. Question 40. The main difference between CAMRT certification and a provincial license is that certification is
A.
optional for all technologists, while a license is mandatory. B. A national recognition of competence, while a license is a legal permission to practice in a province. C. More expensive than a license. D. Only valid for 1 year, while a license lasts a lifetime. Answer. B. A national recognition of competence, while a license is a legal permission to practice in a province. This question requires you to distinguish between two important credentials. The main difference lies in their jurisdiction and purpose. CAMRT certification is the national standard that proves you have the required skills, whereas a provincial license is the legal authority granted by a specific province that allows you to work there. You typically need the national certification to be eligible for the provincial license. For instance, your CAMRT certificate is like a passport, proving who you are, but the provincial license is like a visa, giving you permission to enter and work in a specific place. Remember this key difference. CAMRT is national proof of skill. The province provides the legal right to work.